Welcome to the National COVID-19 Resiliency Network's Community Conversation Series. My name is Dr. Robina Josiah Willock, subject matter expert for communications and dissemination with the National COVID-19 Resiliency Network. The National COVID-19 Resiliency Network's primary goal is to mitigate the impact of COVID-19 pandemic on vulnerable populations in the United States. We have cultivated a robust partnership network with organizations across this nation that serve the needs of persons who have been disproportionately impacted by COVID-19. Our objectives are to identify and engage those communities who have been most negatively impacted by COVID-19 through our national, state, local, territory, tribe partnerships. We want to nurture existing and develop new partnerships to address the COVID-19 pandemic. We want to disseminate culturally and linguistically appropriate messaging in partnership with vulnerable communities, as well as national, state, local, territory, tribe, and government organizations. We utilize technology to make sure that we are linking members of the community to COVID-19 related services. We monitor and evaluate our progress. And we use broad and comprehensive dissemination methods, including mainstream media, white papers, and publications as resources and strategies to bring awareness, participation, education, and training directly to vulnerable communities impacted by COVID-19. The National COVID-19 Resiliency Network is supported by funding from the Department of Health and Human Services, HHS, Office of Minority Health. And now we'll hear a special message from Admiral Levine from HHS.
Hello, and welcome to the Morehouse School of Medicine's National COVID Resiliency Network and OASH Region 4 Community Conversation. Long COVID. What do we know? The purpose of this community conversation is to engage with community members, partners, and stakeholders to address questions and concerns around long COVID, public health practices, social needs, healthcare access and treatment, clinical trials, and community confidence in the COVID-19 vaccines. As evidenced by the dedicated work of many throughout the Department of Health and Human Services, I hope you can see our steadfast commitment to progressing health equity in Region 4 and throughout the country. COVID-19 has disproportionately impacted ethnic and racial minority communities and other socially vulnerable communities. Now, some people who have had COVID-19 can have long-term health problems known as long COVID. Understanding and communicating the current state of the science regarding long COVID and the resources that are available are critically important for those that are disproportionately impacted. It is also important to continue to highlight the importance of COVID-19 mitigation strategies, masks, physical distancing, and especially our safe and effective COVID-19 vaccines. The pandemic has amplified many of the health disparities that have existed in this country for far too long. It is imperative that we capitalize on the momentum and effort that have been put forth to address equity challenges during the pandemic as we address the broader range of health inequities that disproportionately impact communities throughout Region 4. I hope that you will participate with an open mind, focused on learning, sharing, and planning for real change. We can achieve this through partnerships, innovation, and dedication to improving health outcomes throughout the region. I know that you have an exciting day ahead of you, so I will close by expressing my gratitude for your participation in this important conversation. I truly appreciate your past, current, and future partnership with us as we combat health inequity and we address the impact of long COVID of everyone living in America. Thank you.
And now I'd like to introduce Dr. Rhonda Holliday, the Strategic Lead for Communications and Dissemination. She will serve as our moderator for tonight's community conversation on long COVID. Dr. Holliday.
Thank you, Dr. Josiah Willock, and welcome to everyone for tuning in tonight. Tonight, we have a dynamic conversation about long COVID. Our panelists for this evening are Drs. Priscilla Pimu and Dr. Tavia Henry Akintobi. Drs. Pimu and Akintobi are both faculty members at Morehouse School of Medicine and are both affiliated with the RECOVER study funded by the National Institutes of Health. The RECOVER study is designed to understand long COVID, designed to understand the effects of long COVID. So let's go ahead and get our conversation started. So Dr. Pimu, I'd like to start with you.
Sure.
What is long COVID and how does it present? What are some of the symptoms of long COVID?
Okay, so the second part of the question is easier to answer than the first because we really don't know, right? But long COVID is something that in general is called a post-COVID condition. So people who get ill with the COVID-19 virus and then about 4 weeks later, either symptoms never go away, so they remain, or they develop new symptoms. Some of the more common symptoms that people tend to speak of is this just fatigue and exhaustion. And then there's post-exertional fatigue that's like even worse than anything they've ever experienced. So they might be feeling okay, but any kind of physical exertion just gets them completely wiped out. Yeah. And then there are symptoms like the persistence of a loss of taste or smell. There's general malaise. Some people have fevers, and then headaches. And then there are more conditions like that tend to look almost like you have an autoimmune condition. And then there are those symptoms related to the ability to tolerate exercise. So any kind of exertion, their heart rate goes up, they feel real, like they're having palpitations. Usually people who have certain types of who present with certain symptoms during the acute phase tend to be more likely to have those. So persistent just loss of exercise tolerance. So they get their heart rate going up really high from not doing too much at all. People who are like endurance athletes and stuff, they notice this, usually your heart rate is in a very nice range, 50s, 90s, or if it goes up, it comes down, and you can kind of predict what makes your heart rate go up. When they have it related to long COVID, slight exertion and their heart rate goes up and they can't get it down. It just stays. And if your heart rate is up, that's when you feel like you can't catch your breath. Your heart may be pounding in your chest and things like that. So dizziness, shortness of breath, weakness. And then some people have sort of symptoms related to mood. There'll be depression, anxiety. Some get pins and needles, some get dizziness, some get sleep problems. Or I don't know if you've heard of this, people just talking about having this brain fog, just not being able to keep a thought, follow a thought through. So it affects people in so many different ways. I think what makes it a bit of a challenge clinically is because there's so many other conditions that can have each of these symptoms. And so some of the struggle for people who are experiencing these symptoms is to get someone to even pay some mind to what they're describing. And so a lot of the effort, I guess, and advocacy from the patient side is to say, when you're experiencing this, go see somebody, talk to them. And there's a lot of guidance out now for healthcare providers on how to respond and additional testing that they should be doing.
Okay.
That was a mouthful.
No, but it was a very good mouthful. That was a lot of really good and important information. So a follow-up question that I have, is there a length of time for when these symptoms actually onset? And then how long are people sort of experiencing these symptoms?
Okay, so that's really great. By definition, the one we're working with now is after 4 weeks of an index illness, any symptoms that return, persist, or worsen is regarded as long COVID or post-COVID condition. Now, if you're having those symptoms, and sometimes we know that in the natural history of COVID, sometimes it takes up to 12 weeks to clear. But having that marker at 4 weeks helps people to actually get the help and assessment and evaluation they need, so that if it's not progressing the way it should, they'll get help sooner rather than later.
Okay, great. And so just following up on a point that Dr. Pimu made, and I want to turn this over to you, Dr. Akintobi, when she mentioned health disparities. So I want to ask you, what do health disparities and health equity still have to do with advancing health equity as we continue to understand long COVID? So what's the relationship between health equity and long COVID?
Right. So, you know, a couple of years ago, when we were just getting into understanding what COVID was, we were talking about, and people were becoming familiar with what health disparities were. And, you know, that translated to the fact that whether people are identifying as a racial or ethnic minority, or they live in a place where they have less access to healthcare, or they may be defined as having lower socioeconomic status. All of those factors and more can lie within one individual or within one group of people. And those were the things that people who didn't know about what we do in public health or in clinical research began to know and realize that those factors worked together, especially if people had other comorbidities or co-occurring chronic conditions like asthma or cardiovascular risks or diabetes, that all together those health disparities and issues for some people place them at increased risk for getting COVID-19. And so stated differently, disproportionate hospitalization, illness, and death were among those that represented risk for other things because they were described as being a part of a health disparity population. We don't use those terms anymore, but the reality is increased hospitalization, illness, and death in some instances has a profile. Some of it is defined by race and ethnicity and other factors because of the political and social drivers of health. And those things are factors that are connected to the degree to which people could take time off work to shelter in place, have access to health insurance, or know that they didn't have to have health insurance to get a COVID vaccine. So we need to remember those things as we think about long COVID, because the same groups that may not have gotten the vaccine or may have had other chronic conditions will be those that are more likely to experience long COVID if we don't do what we're doing this evening to communicate effectively and share with them the resources that can get them the supports that they need. So as we think about long COVID, we need to remember that among the factors that can contribute to the risk that we know right now includes not being vaccinated, right? And so as we think about our messaging and how we communicate about the symptoms of long COVID, we need to continue to communicate what those behaviors are that can decrease risk for everyone, but particularly those who now know that because of other comorbidities that they experience, they may be more likely to get COVID-19. So we need to think about those risk factors when we think about the best communication strategies for those that we serve and support in communities.
Okay, great. So I like that you brought up some risk factors for long COVID, but also some mitigation strategies. And so this is open to either one of you. We know that getting vaccinated will decrease your chances of contracting COVID. Are there any other mitigation strategies that you all are aware of, particularly for long COVID, that may prevent someone from developing long COVID?
I think the biggest one is not to get sick. And in order not to get sick, apart from taking the vaccine, which clearly has shown evidence of helping people not have, even if they do get sick, not have as severe an illness, is to follow the other instructions, relative to masking, relative to physical distancing, all of those things that reduce your likelihood of getting the infection in the first place helps to reduce your chance of having this post-COVID condition. If you have been vaccinated, there is evidence that even if you do get infected, that you will not have as severe an illness. And in general, the post-COVID conditions are worse in people who suffer severe acute illnesses. So, it's like it's all connected. It's all connected.
All
I
right.
think Dr. Pamela is spot on. I think how we communicate the fact that, there's some myths that we still have to dispel about, if I've had COVID before, that means I can't get it again. And just because I'm vaccinated, and I will have less severe symptoms, then that's fine. But I think folks need to also think about those people that are a part of their social bubble, whether they live under their roofs or are in their broader community. As we respect people's choice and promote vaccinations, we need to consider those people that are close to us and the risks that we might be placing them at if we do not do those simple things like still physical distancing, wearing masks, among other things. So considering not only your own reality, but those that might be near you that may have comorbidities that place them at risk if you don't take those precautions.
Okay, great. So what are there any treatments for long COVID available?
At this point, we can't say treatment for long COVID. So depending on what symptoms you're presenting with, they can treat the symptoms that you have. Regarding actual treatments for what is eventually defined as this syndrome of long COVID, there are clinical trials ongoing. Some of the things that we know, so for instance, if you have comorbid conditions and, getting those under control will help you. If you have certain symptoms, one of the first few things that get checked and repleted is like your vitamins and things like that get repleted because of all this fatigue and exhaustion. Apparently, there's a strong role for that at present. Some people have come up with, prescriptions for different ways to exercise, depending on what symptoms you're having, what musculoskeletal symptoms you're having, and things like that. If you're having the GI symptoms, so it's really, it's symptomatic treatment from your healthcare provider. That's what's going on at this point. So get a good history, figure out what the symptoms are that the person is dealing with, and then manage those symptoms. There's not yet like a treatment for a condition known as long COVID because we're still working to define that condition because it has so many intersections with existing health conditions. Like it doesn't have any specific things that point it out and say, this is just long COVID. I don't know if that's helpful.
No, that is very helpful. So it's really more about treating those symptoms
Right.
that you may be experiencing, and that there isn't really a treatment for long COVID, but it's really about treating those symptoms.
But there are valiant efforts underway, clinical trials. So even as we're amassing this recovered cohort that has people with all different kinds of symptoms post-COVID, right? At the same time, there are clinical trials starting to test out different hypotheses of how do we manage this, especially with some of the more severe post-COVID condition symptoms.
Okay. And so I think that's a great segue into another question that I have, which is about clinical trials and participation in clinical trials. You know, we heard a lot at the beginning of the pandemic about participating in clinical trials. So can either of you speak to still the importance of participating in clinical trials for community members?
Dr. Akintobi, you want to take that?
Yeah, it is so, you know, we know for many reasons and even outside of research and in public health that representation matters. And so in order for us as a scientific community, you know, those of us who really have dedicated our lives to ensuring that we advance health equity, that means that it's very important to do a few things, not just ensure that Black, Latinx, and other communities that are disproportionately impacted by the pandemic are a part of clinical trials, but that even before they say yes, there is a history of trustworthiness by organizations that they feel have their best interests at heart. And so, you know, representation in clinical trials is very important, but I think folks like Dr. Paymu, who I know well, and I know the important work of the National COVID Resilience Network is to ensure that there is a relationship of trust to do a few things. We know not everyone is leery, particularly minorities are leery of participating in clinical trials only because of Tuskegee or Henrietta Lacks. We know that even across the spectrum of people who are considering participation, some of them have questions that are about what's happening now, how quickly the vaccines are, the perception of how quickly the vaccines were developed, which we have answers for that. But there are questions that we need to be prepared to answer as they think about participation. So as we think about the importance of representation to ensure that for every type of person with risk factors, that they are represented to figure out what people need and the amount that they needed to have their most optimal health. We need to ensure that the work before that answers the questions and establishes trust is there. And so that's something we need to acknowledge people's hesitancy. And I like to say that people's hesitancy, it many times is justified. Before you make any big decision, you need to have all the facts. And so meeting people where they are, taking the time before you engage them in any type of clinical trial to have that relationship to answer their questions is important. So I know Dr. Paymer would agree, but we want to arm community residents with what they need to determine whether we are worthy of their trust to consider participation in a clinical trial. Hope I teed you up well, Dr. Paymer.
I think you said it really well. And so for folks who might be wondering, you know, if you want to participate in a study, you're wondering where you can find information about ongoing studies. So clinicaltrials.gov is a website, clinicaltrials.org. Give me a second here, let me confirm that. I mix it up.
Clinical
Is it org?
It's .gov.
Thank you. I'm always like, is it org? Is it gov? It's clinicaltrials.gov. My apologies there. And you can go in and you can search by, you can put in something like long COVID, put in your zip code, studies that are currently enrolling, and it'll tell you, or studies that are in planning, so that you can reach out to the team. Usually there's a number, an email where you can reach out to studies that are either currently going on or in planning to test out treatments for long COVID. Like I said, we are currently pulling together what we call a cohort, an adult cohort. So we're gathering together people who have had COVID, who either are within that 4-week window of getting COVID or past the 4-week window, so they're post-acute, but they're experiencing symptoms that have not resolved. We're enrolling those people. You can go to Morehouse's website, www.msm.edu, and there's a Recover link. The study is known as Recover, that's RECOVER, and you can just signify interest. So it's a citywide study. Morehouse is participating in collaboration with Emory University, with the VA, and with Kaiser Permanente. So if you go to any of those health systems, you can participate in the long COVID study. The study we have visits all the way out to 48 months, but the first visit pretty much asks a lot of questions about your different symptoms, and depending on what symptoms you're having, then you can get additional testing. So like I said, the evaluation for any of these post-COVID symptoms is really an evolving thing. And what this cohort is trying to do is do all of the relevant testing so we can make decisions. If you're having dizziness, you might get a tilt table test. If you're short of breath, you might get pulmonary function test, get a 6-minute walk test. There's any variety of tests that can happen. But the purpose of the Recover cohort is to get many people who have these symptoms spend a lot of effort trying to characterize these symptoms in detail with objective tests so that we can reach some conclusions about what exactly is long COVID. Right now, we just have a lot of symptoms and we're not sure. This is how we get to that answer.
Great, thank you. And I think it's important that you highlighted other clinical trials, the Recover study, and the importance, I think what Dr. Akintobi was talking about, the importance of participating in these types of studies as we think about health equity. And so the way to get to health equity is for people to participate so that we can find out what's going on with everyone. And it's not just about race and ethnicity, but also thinking about those co-occurring conditions and chronic illnesses. So we want to get a complete picture and not just have the studies done on one type of person or one group of people. And so it's important for that participation. So you've explained the Recover study really well. One follow-up question that I had for you is this study only being conducted in Georgia, or is the study being conducted in other places across the country?
So Recover is a nationwide study.
Okay.
So if people are listening to it from other parts of the country, they can just search Recover. Depending on what city they're in, they'll be able to tell if there is an enrolling site close to where they live. Pretty much, there's studies, there's like hubs and sites all over the country.
Okay, great. And is there a centralized website that people can go to, or just type
Yes,
in Recover?
I will tell you in a second. It's Recover NYU Langone.
Okay, great. And we'll make sure that we have that resource in available for our audience members. And so while you're looking for that resource, Dr. Akintobi, I'd like for you to talk about your role in the Recover study, because both you and Dr. Pemu are involved in the Recover study, and you have two unique roles. So can you talk about your role?
So I'm indirectly connected with Recover through my work with the SEAL network. So SEAL is a community engaged alliance against COVID-19 disparities. We're on a train, and I want to say we might say it's a bike that we're riding as we're building it, but I think COVID has created a train that we are all getting on because we have to, right? So the SEAL network was designed and is nationwide to conduct urgent community engaged research, particularly in states that we'll just say have been COVID hot. And of course, these are states where in the beginning there was a larger number of minorities and other disproportionately impacted communities that we're learning, engaging, and really amplifying their voices through things also like like NCRN. So SEAL's focus really has been on communication strategies based on us understanding that one size does not fit all, and really galvanizing community leadership in states, and there are now 21 states that are now connected with SEAL sites, if they are in those states, with recover sites, to ensure that those community networks are connected to individuals and patients who are participating in recover. So through Georgia SEAL, which is my point of service and leadership, there's actually a co-chair of one of the national community engagement committees for recover. And through our Georgia SEAL collaboration, we also have leadership through SEAL that's advising the recover study. So what I'm particularly excited about is, as Dr. Paymu stated, there are community leaders across the US, many of them that are connected to SEAL, that are ensuring that the messaging and the translation of messages and communication related to long COVID are really community co-created. So that's the point of synergy. And definitely many people who might be listening are thinking of themselves and their own experiences in considering long COVID and how it impacts them. But they may also be serving particular community groups across the US in navigating COVID-19 education and even materials related to understanding long COVID. So if you go to covid19community.nih.gov, there are a wealth of resources, whether they are social media, fact sheets, and other videos that have already been curated by community leaders from SEAL that are designed to help you, give you tools and resources that you can use to communicate and educate. So again, if you go to covid19community.nih.gov, because we're both NIH funded networks, there are great resources there that you don't have to create from ground up that can help you to communicate about long COVID, but any other issues related to clinical trials, vaccination, and related communication messages.
Great. So thank you for providing that resource. As we have been going through the COVID-19 pandemic, it's really important for us to have trusted sources of information. And so I think that that will be a great resource for people. I haven't heard of any myths around long COVID yet, but I'm sure that they will crop up. But it's important for us to be armed with that, with factual information that we can share with our families and friends and other community members who may have questions. So
I wanted to share real quick. I put the link in the chat. It's studies.recovercovid.org.
Okay.
If you go there, it has specific instructions on how to find recover study sites across the country. So you can say what kind of enrollment site you're looking for. Is it a site that enrolls adults, babies, children, and teens, people who were pregnant since January 2020, or tissues and organs of a deceased person? So those are the different cohorts. And then you can say the COVID status. So did they have COVID in the past month? Did they have COVID over a month ago? Have they never had COVID? And then you can put in a city, state, or zip code and hit the find study site. And there are sites all across the country. Basically, that's all it takes to find a site. And then you can ask to join. There's a button that says ask to join once you find a site that's close to you.
Okay, great. Well, thank you so much for that, Dr. Paymu. That is definitely a resource that I think many people will find useful for those who may be interested in participating in the Recover study. So as you know, we have entered fall. The weather's getting a little bit chillier now.
Yay.
And I'm not sure if we're in the false fall yet or the real fall, but
As long as it stays around 70, I'm good.
exactly.
Yeah, I was about to say, Dr. Pema, this is the sweet spot, and
I'm saying
it's rough.
it's to
rough.
stay like this for months and months.
Exactly. But as we move into fall, which will turn into winter, and we begin our holiday season and gathering with family and friends to celebrate one another and celebrate the season, what are some important things for us to remember as we go into this fall and winter season when we're thinking about COVID-19?
One of the big things that's been, kind of trumpeted and spoken of, so I'll just repeat it at the risk of being redundant, is in addition to getting the boosters that you're eligible for, get your flu shot. Get your flu shot. Especially for those who have children, there's an RSV kind of thing that's coming on the front end of the flu season. It's coming a little earlier. So get your flu shot. Don't forget all of those things we learned in those 2 years since 2020, even though the pandemic has been declared, done, but we still need to do what we know to do in order to stay healthy. Wear a mask if you're going to be indoors. Wash your hands. All those things actually reduce the chances. Do you remember that in 2020 and 21, when we had the mask mandates, there were much fewer cases of the flu?
Yes.
Much fewer.
Yes.
Who wants germs if they don't have to get them? I'm just saying.
I think we have to go back to basics, right? So
Right.
the things your mom told you or your teacher told you, these are all things that, wash your hands.
Wash your hands.
Wash your hands. All of these things now are not just about, germs, but they can be, depending on the person's health, among many other factors, can be the difference between life, death, or long COVID, right? And so, yes, we're in a place where people are ready to bust loose and get together with friends and family, but we must mind ourselves and mind those, right, that we care about, particularly those that might not be as healthy as we are. And so moving into this season, as you described, it brings a lot of warm feelings and emotions for others. And so we want to make sure that next year, this time, we're around healthy, wealthy, and wiser. So I think very important. And one thing I'll add, as we talk about long COVID and even some of the symptoms, we must remember to mind our mental and behavioral health. This is also a season where pre-COVID, this is a place where a lot of people's feelings and emotions are not necessarily positive. And so moving into this season, many of us having experienced loss of those that we hold dear. There is the neck up health that a vaccination cannot fix. And so just reminding all of us to mind our mental and behavioral health. And if you're not feeling well, just as if you're not feeling well physically, to talk to somebody or go and see someone. And I know NCRN has great resources as well that you can plug in by where you live or where you lead to pull up resources. And some of those include mental and behavioral health resources.
Yes, thank you for that reminder that mental health is very important. And I think that has become something that is more on the forefront since we've been in this pandemic, that people are really paying attention to their mental health and some of the effects that being in the pandemic has had on our mental health. So that was definitely a timely reminder. But it also brought about another question in my mind when we were talking about the RECOVER study. Is there a component of the RECOVER study that looks at mental health and maybe the effects of long COVID on mental health and how people are coping with long COVID?
Definitely. So among the battery of questions and questionnaires and instruments and things that people respond to, there's definitely a strong component that evaluates people's mental health and their experiences since their illness. I think the other thing I should share, because it's pretty prominent in the conversations and it's something that affects people's just overall welfare, is if you can't go back to work because you don't feel right, there are people who have suffered from that, right? Because their symptoms are persisting. So it pays for people to, I think it's important to emphasize that it now has a status of a disability,
Yes.
that they can get resources to support while they're going through this, so that because a lot of what goes on in people's minds is, how am I going to cope with, how am I going to take care of my family? How am I going to do that? But you can't breathe, or you're having whatever symptoms it is that you're having that's affecting your ability to be who you were prior to the illness. I just wanted to share that. But to your specific question about recover, yes, it's a big part of the assessments, because I don't know if I emphasize this enough. One of the symptoms that have qualified as a post-COVID condition is anxiety, depression, just mood changes. So that's part of the post-COVID condition. So we are evaluating that just the same way we evaluate changes in your heart rate or your ability to breathe.
I'm so glad you emphasized that, Dr. Paymo, because it may be tough for people to disentangle how they were already feeling with this being a symptom of long COVID. And in either case, the fact that Recover is assessing all of these things to better understand it. It's a complicated time, and I think Recover is really looking to disentangle that and give people who are interested an opportunity to learn what they're experiencing, but also contribute to the broader science of how we can respond as a community and advance health equity in this space.
Okay. And one other follow-up question for Recover: is it only for adults only, or are minors also?
So in Atlanta,
Mhm.
our site is for adults.
Okay.
But across the country, there are sites that do children and teens.
Okay.
There are other sites that do people who are pregnant. There are other sites that do people who were deceased from COVID. So there are different cohorts. We are a part of the adult cohort.
Okay, well, I think that's really important to know, is that, again, looking at the diversity of those who we want to participate in clinical trials, in studies, particularly about long COVID, we need to see the gamut of people, because it's not just adults who were affected by COVID. It's not just pregnant people or children, but we want to see that cross section of the population that was actually impacted by COVID, because it did not discriminate in terms of who was able to who was affected by COVID and who could actually contract COVID. So that's good to know that it's not just for adults, but it is a cross section of individuals. And we want to make sure that we increase, that we have participation even within those cross sections, that we have diverse participation from various communities that were impacted by COVID. Okay, so this has really been a great discussion, and I just want to sort of ask one or two more questions as we wrap up for this evening. So I wanted to know, Dr. Akintobi, you're out there in the community. What have you heard people in the community say about long COVID? Is this something that people are discussing?
They want to know, like, basic things, like, does that mean having COVID for a long time? I mean, some of it is just about clarifying what it means. But as we've begun to have conversations, there's almost like a sigh of relief when people hear that, oh my God, it's not just me.
Uh-huh.
is actually a thing, right? That can help them to feel validated, understood, and that it really is not all in their head. And I think just as we've had to advance communication on what COVID is, we really are in a place now where people who are impacted have been doing so silently and now have an opportunity to air what they're experiencing, and through things like Recover, have a place to go to learn more about themselves and to contribute to the science. So it really is a sigh of relief that this is something that they're not alone in, and that there's room to contribute to understanding themselves and the broader community. So it's really a new level of our joint responsibility in meeting people where they are, and giving them information, but also something that they can do about it. And I think Recover is just that opportunity.
Okay, great. And Dr. Pemu, just one last question for you. Just for clarity, is the Recover study looking at any medication or treatments for long COVID?
No.
No. Okay.
The Recover study is just amassing a cohort.
Mhm.
That cohort is who can, once you have the cohort that's well characterized, when the clinical trials that are being proposed will be conducted on volunteers from that cohort to start with, because it'll be a cohort that's very well characterized. You know how it is, if you're not sure what the status is at study entry, then it's harder to tease out what is the impact of a treatment versus not. And because the symptoms are so broad, because it can look like so many different things, this effort to create a cohort that's well characterized that can then support further study is based on that premise.
Okay, got you. All right. And as we close out this evening, I do want the opportunity for you all to provide any last thoughts or parting words before we wrap up this evening. So I will start with you, Dr. Pemu. Is there any thing that you would like to emphasize or say as we wrap up this evening?
Really, that I appreciate this opportunity to just speak to the work that's going on behind the scenes. We've had quite a bit of enthusiasm from participants. But one of the things I noticed, because a lot of people who have been living under this, to Dr. Akintobi's point about just the sense of relief to know that there is a thing that is causing all of what they're experiencing. So a lot of people volunteered to serve on these national committees. And there is some frustration. So it's interesting about seeing the scientific sausage making from the perspective of someone who's not usually in that space. I would say to people that they should participate, they should bring their views and questions and things, they should be on those committees and ask the questions that need to be asked so that we can get shaken up, even as we're trying to stick to, all the processes of doing the science and things like that. I think it's really important for community to stay engaged and not to leave this level of awareness and engagement that I'm currently seeing. I'm really excited by it, and I hope it continues. And to keep an eye out for those studies, if they're interested. Several of them are already being approved, because as the cohort is being accumulated, there's everything is kind of going to Dr. Akintobi's point about you building it and writing it at the same time. Studies are being approved. So go to clinicaltrials.gov, enter in the kind of study that you're looking for, the symptom that you're worried about, and see if that study has started for long COVID. Sign up for it so that you can be at the forefront of what we find out and learn about the science. Thank you.
Thank you. And Dr. Akintobi, any parting words from you?
Yeah, I want to just commend, and of course, we're a part of what you, Dr. Holliday, and Dr. Josiah Willock are seeking to do, and that is to have community conversations, to educate you on some of what we're contributing to nationally in the COVID recovery conversations, but that we cannot do this, as Dr. Paymu said, without community leaders and voices to not say yes, but to push us. Our intent and pursuit is to engage you in ways that make sure that community voices are at the forefront of COVID recovery. So be patient with us, but we want you to push us to make sure that your questions are answered, so that this is for you and by you, and that together we recover through this pandemic towards health equity.
All right. Well, thank you both for taking the time out this evening for, I think, what's a very lively and enlightening conversation about long COVID. I certainly learned a lot about long COVID this evening, and I hope our audience has as well. So I'm going to turn it back over to Dr. Josiah Willock.
Thank you, Dr. Holliday. This has been a wonderful time we've spent here today. I want to thank Dr. Holliday for moderating this timely and important discussion. And of course, I want to thank you, Dr. Paymu and Dr. Akintobi, for sharing your time and your expertise with us today. Thank you so much. Before closing our community conversations, we'd like to highlight a few NCRN resources. For everyone who tuned in this evening, we welcome you to join the National COVID-19 Resiliency Network to stay up to date with the new COVID-19 information and resources. Please visit our website. It's www.msm.edu/NCRN or www.covid-resources.org. You can also download our free app to stay informed of COVID-19 right at your fingertips. Or if you need to, call us on our toll-free multicultural hotline at 1-877-904-5097. And of course, you can join us on our social media platforms. We're on Instagram, Facebook, Twitter, and LinkedIn. We also have some additional resources, some of which were mentioned tonight, that you will get from HHHS for our viewers today. And now I'll turn it back over to you, Dr. Holliday, to close us out for the evening.
Okay, thank you, Dr. Josiah Willock. So at this time, I'd just like to take a moment to thank our partners at the U.S. Department of Health and Human Services, Region 4 Health Equity Council, for co-hosting this event with us this evening. A special thank you to Admiral Levine for her timely message on long COVID. And thank you again to our panelists, Drs. Paymu and Akintobi, for sharing your expertise and your wealth of knowledge. For all those who attended this evening, we thank you for your presence, and we hope you have gained some valuable information. You will also receive an evaluation via email, and we ask that you please complete and submit the evaluation. So thank you for joining us this evening, and have a great night. Bye.